Numbers with Sherrod, and we're looking at Susan. So we're going to have a video that will be showing Susan before our help, and at the end we're going to have a video of her after our treatment was administered. So.
This is Susan. Susan is a 55-year-old woman who lives with a lot of health-related issues. Susan is married to a man who we'll call Bob. Bob is also 55 and is the father of Susan's 8 children, ranging from the ages 17 to 35. Susan works at a local hospital and has for over 25 years, but she doesn't always follow her own advice she gives to patients. Susan has been smoking on and off for over 30 years, but despite many attempts, has not been able to kick the addiction. In addition to this, Susan does not eat very healthy, and to only worsen the situation, she struggles with the bills because her husband was laid off from work almost 2 years ago. She has to also care for her grandchildren when she's not in the hospital, leaving little to no time at all for healthy foods and/or exercise. After being overweight for years and struggling with high cholesterol, Susan has been complaining of a lack of energy. Her doctor insisted she perform a series of tests associated with her heart, checking for possible blocked arteries. This scares Susan and compels her to refuse to take the test. You're Susan's trusted friend and a medical professional. She comes to you for support.
Alright, so that was our video. So you heard Susan is a chronic smoker. She has been since she was 19 years old, and she's overweight now, on the verge of diabetes, and now we'll talk about the population, so part of the population that Susan is in. So the population. Based on Susan's profile, we can see that there are people like Susan that might lead busy lives. They might have to put others before themselves. They might be in a low income bracket. They might lack the ability to take their own advice. And here are some of the social factors. So stress is one of the biggest issues with people like Susan. So first we have to ask ourselves, what is stress? Stress is defined as when you feel threatened or off balance in some way or another. And there are a lot of issues with stress. We all have it in some way or another. We all know what it's like. So there can be pain, fatigue. You can be obese over time. You might have eating issues. There will be sleep issues possible. And like I said, we all have it in some way or another, and it can be found in lifestyle changes. If you're moving or something, stress can affect you. Relationships, like Susan with her husband Bob, she's having issues there. And then work and finance, her husband was laid off from work and she works very often. That's one of her issues. And it can be eased, it can be treated. You can learn how to manage stress. You can get a schedule working that works for you, take changes towards it, and relax. And then, like I said, it's common, everyone has it, and it's potentially dangerous, but very treatable. And so a couple of healthier ways to reduce stress would be yoga, meditation, prayer, anything that works for you, anything that you can do to help yourself feel more at ease. And now we have the media. So the media portrays smoking as cool, popular, things like that. The younger generation, they're trying to get addicted to nicotine, get into smoking. And so you see people in movies, TV shows, you've seen it everywhere, where they're smoking and everything, making it seem cool and promoting it. And you also do see the prevention ads in modern day TV and some movies and stuff, because it is very bad for you. All sorts of cancers and carcinogens are in cigarettes. And here we have an ad from the Camel Company, a nicely dressed camel person offering you cigarettes. So it might seem like fancy people smoke. And now we're moving on to heart disease.
Alright, heart disease is just the disease that affects the heart, obviously. Alright, and this is the causes. So this is what Susan is causing. The buildup of fat in the arteries, and this narrows the arteries, which blocks the flow of blood to the heart. And she's a smoker, and that makes her 4 times as likely to develop heart disease. And she has high cholesterol and high blood pressure. That can lead to heart disease and stroke. And symptoms of heart disease include anxiety and restlessness, shortness of breath, weakness and feeling lightheaded, nausea and vomiting, pain, numbness, and mild swelling in the feet and ankles, chest pain, tightness, pressure, squeezing, or fullness, and that is also referred to as angina.
Yeah, so prevention of heart disease.
One of the biggest preventative measures is simply not to smoke. There are many chemicals in tobacco that can lead to heart issues. Also exercise, getting an exercise regimen, a consistent daily regimen to work on your fitness. Also eating a heart-healthy diet, which should include vegetables, fruits, whole grains, nutrients. Also maintaining a healthy weight, because those that are overweight or obese are more susceptible to heart disease. And finally, get regular health screenings from your doctor. Now, some of the treatments for heart disease. The first line of treatment for heart disease is simply lifestyle changes such as exercise and a better diet, as mentioned before. But if these lifestyle changes aren't enough, as seems to be the case with Susan due to her busy and stressful lifestyle at her workplace with her family issues, there are medications such as diuretics, angiotensin-converting enzyme inhibitors, which block the formation of the hormone angiotensin, and they have proved in studies to work very well, so it might be a good option for Susan, and also beta blockers. Additionally, blood thinning medications such as daily aspirin therapy or cholesterol-lowering medications can be used to treat heart disease. And finally, in the most serious cases, medical procedures or surgery may be necessary to clear blockages of the heart. And here's a diagram of them.
Okay, so as we mentioned, Susan's main vice is smoking. The primary ingredient of a cigarette is nicotine, which causes the addiction. It also causes both depression and anxiety. The reason nicotine is so dangerous is because it releases neurotransmitters. An example of this would be dopamine, which causes a sensation of euphoria, which you then get addicted to. The addiction has both behavioral and biological causes. Cessation means basically quitting smoking. This is very difficult for most people who have been smoking, especially those like Susan who have been smoking for a long period of time. The most effective method of smoking cessation is a combination of both counseling and medication. Support groups and therapy can provide the moral support needed to effectively and permanently quit smoking. Some other cessation medications that aren't up on the screen, just to provide a few examples. There's a patch that can be used which slowly releases nicotine through the skin, thus helping you kind of ease off the addiction. That takes 12 weeks. There's also gum you can use, there's a lozenge you can use, there's an inhaler. Those also take about the same time frame. In terms of pills, there are two main ones. Zyban is a common antidepressant that can be used to help you quit the addiction, and Chantix helps block nicotine reception in the brain. So as we've established, smoking is obviously bad. Each year in the United States, smoking causes 440,000 deaths each year. 69 out of the 4,800 chemicals in cigarettes are known to actually cause cancer. So here we have a diagram of some of the negative chemicals that are in a cigarette. You can see you have cadmium, which is found in batteries. You have candle wax. You have insecticide. You have toilet cleaner, rocket fuel, sewer gas, and lighter fluid. So imagine putting those chemicals into your body each day. That's pretty bad. So our recommendation for Susan, based on her smoking, would be obviously to stop smoking and to help prevent the development of diseases such as cancer that smoking can cause.
Okay, so now we're going to move on to obesity. And obesity is known as having an excessive amount of body fat. And it's not just a cosmetic disease. It also can affect your daily life and increases your risk for possible heart disease, diabetes, high blood pressure. And doctors use BMI, or body mass index, to determine a person and assess a person's physical fitness level and how they are physically, and also different ways. So a person has a normal BMI around 20, and that means they're healthy, and that's a good weight. And then a person who has a BMI about 25 to 29.9 is considered overweight. And then when a person becomes morbidly obese, they have a BMI around 30 to 40. And now also some different causes. We have genetics, we have the social environment, we have not enough exercise and unhealthy diets. Really, it can be passed on, and also social environment, what you're used to, what you're living with. Your parents are obese, or really just in society in general. Society is not really meant for an obese person. It's really has a stereotype as for skinny people. So really, for Susan, it is a little bit depressing, and her unhealthy diet attributes to that. So effects and complications. Obesity can cause diabetes, heart disease, stroke, high blood pressure, and sleep apnea, gout, and hypothyroidism, hypothyroidism, and atherosclerosis, hardening of the arteries, and sleep apnea, which Susan may develop because of how overweight she is, and how having all the fat and all over her trachea can actually stop her from breathing for a few minutes or seconds during each night. So now we have some mental effects. Obesity can affect you greatly mentally also, as well as physically. And obesity can really cause you to lower your self-esteem, because with obesity, you don't feel as well, you don't look as well, and really you don't have a great image about yourself compared to everyone else that you're looking at in media and everything. And depression, obesity can cause you to go into a state of depression because you are at such a low self-esteem and you don't feel great about yourself. And anxiety. Susan is always worried about herself, always worried about doing the right thing, but she never actually focuses on herself, always on her patients. So now we have some different, it can affect part of your body. It can affect your joints. Really having all that extra weight really doesn't help you even walking up the stairs. It gets very difficult. And your breathing, having all the heavy weight really takes a lot to take in each breath, and it's very difficult. And also your blood pressure and cholesterol. Obesity can cause hypertension, or it's overactive blood pressure, very high blood pressure. And then with also including stress and tobacco, it can also cause high blood pressure. And also cholesterol, there's good cholesterol and bad cholesterol. And bad cholesterol is cholesterol that will then get stuck in your arteries and cause buildups and plaque. And good cholesterol actually takes the cholesterol and brings it to your liver to be digested. So now we have some social effects. Really obese people have taken surveys that have said that obese people really do not have a very romantic or few social relationships because they have such low self-esteem and depression. They really aren't confident in themselves and going out in the world. And also in high school and all throughout school, people are actually, and in the workplace, people can be discriminated due to their weight and size. They're not conforming to the social trends, or they're really trying to be themselves. And now also Susan is really has a difficult time doing everything else. And now really prevention and cures. There are many ways really to prevent and cure obesity, really through lifestyle changes, surgery, or medications. Really the main thing that we suggest for Susan is for calorie-restricted diets, and really see a nutritionist, and really get maybe a personal trainer to start training out and really trying to lose her weight before she then goes to the radical decision of possibly surgery. Because there's also the gastric bypass lap band, which do not have all the time to really work out. You may lose a lot of weight at the beginning, but then most patients actually gain most of that weight back. And then there's cancer.
Okay, because Susan has been smoking for over 35 years, her body is at a very high risk of developing 2 types of cancer, and one is lung cancer. Lung cancer begins when abnormal cells grow out of control of the lungs, and each year 157,000 deaths occur in the U.S., and 90% of lung cancer patients develop the cancer from smoking. The 2 types of lung cancer are non-small cell lung carcinoma and small cell lung carcinoma. The small cell lung carcinoma is actually the most common one, and it's strongly linked with smoking. Some of the causes of lung cancer include long-term exposure to smoke, secondhand smoke, and exposure to asbestos. And it is most likely that Susan will get lung cancer if she doesn't quit smoking from long-term exposure to smoke. Some of the symptoms of lung cancer include constant coughing, shortness of breath, wheezing, weight loss, and difficulty in swallowing.
So there's 4 stages of development of cancer. The first one is when the cancer is actually grown, but it's not metastasized throughout the body. 2 and 3 is when it's local to a specific organ with a chance that the adjacent organs could be affected. And 4 is when it's fully metastasized throughout the body. There are multiple tests that we would have to run if Susan were to actually develop lung cancer. The first one is a CT scan, which is a medical imaging method. Bronchoscopy, which is a test to view the airways. A PET scan, a biopsy, and a complete blood count test. The surgical procedures that we would have to go through are removal of the affected tumor or the lung, as well as the nodes. Alright, so the medical procedures are chemotherapy, which is the use of drugs to kill the bacteria, fungi, and other cancer cells throughout the body. It's used to cure the cancer and to keep it from spreading. There's radiation therapy, branchial therapy, and palliative cancer therapy. The only advice we can really give Susan, because she has smoked on and off since her teens, is to really just quit smoking, because it greatly does increase the risk of lung cancer, and just to avoid secondhand smoke in general. And if Susan keeps smoking, that's what her lungs will develop into, if they haven't already.
Another form of cancer that she could develop is throat cancer. And throat cancer is defined as cancerous tumors that grow and develop inside your pharynx, larynx, or tonsils. So, people who use tobacco or smoke are more susceptible towards developing throat cancer because you're inviting these substances to come into your body and affect you. Most throat cancers start to develop in adults who are over 50, and Susan's 55, so she's right in that age range. And then the symptoms are like coughing up blood, like having difficulty swallowing, having lumps or your neck very swollen, and a sore throat that doesn't get better over time. You could treat it by attempting to prevent it from spreading to other parts of the body. You could have surgery or radiation therapy, chemotherapy, removal of the vocal cords, swallowing therapy because your throat gets really sore and it's hard to swallow. And throat cancer, if caught early, can be cured 90% of the time. If cancer spreads, it is not curable. It will only be prolonging it. So that's why we recommend that Susan does get tests done so that she can get a step towards helping herself, because if she doesn't, then she's just going to get worse. And then the exams to test for throat cancer are like a CT scan, an X-ray, and if the tumor is present, a biopsy is performed, where you take a sample of the.
Alright, so at the beginning you saw the other video, and now we're going to show you that if Susan listens and she understands the problems she has, she'll be able to implement them into her day-to-day life and her very busy lifestyle. This in turn will improve her general quality of life, as shown in the following video.
Hey, it's Susan. Yes, it's Susan. Hey, it's Susan. Coming down to school. Yes, it's Susan. I'm 55. Yes, I'm Susan. I'm over it. I stand for life. So life is second. I'm dreaming too. Yes, my name is Susan. Hey, it's Susan. Yes, it's Susan.